I want to welcome everyone here for what is a really important announcement for our city and for our community. I'm really, really happy that we can be here at the South Riverdale Community Health Center, which has been at the forefront of community health for over 40 years and at the forefront of harm reduction here in our community for over 20 years. Really doing amazing work every day, often unrecognized. So really nice to be able to be here and to showcase some of the really hard work that they do and to celebrate it a little bit as well. I'm here with Minister Hajdu and also two of my colleagues, Adam Vaughan, Trinity Spadina, and Rufarani from Parkdale High Park, also great supporters and who are excited to be here with you today as part of this announcement. Quickly, I'm also going to say a Happy New Year to anyone who's starting to celebrate tonight. Shana Tova. It's always kind of nice to have new beginnings, and this is a really exciting time to have a new beginning. I know I'm ready for one. So really, without much further ado, I'm going to be welcoming with us Minister Hajdu. She has done so much work tirelessly since becoming our Minister of Health and has a real deep connection to the issue of harm reduction and how do we work to truly manage the social determinants of health and all of the important pieces to deal with the issues of harm reduction and how do we make for safer whole communities. And we've had great conversation earlier today with people who are working directly in our city on these issues and talking about how we can all work together. And her commitment is strong. She has a history in having worked in these issues back in her community of Thunder Bay and brings a ton of knowledge and commitment. And so really great to be able to have these conversations here and to see how we can move it forward with announcements like we have today. So thank you very much, Minister Hajdu.
Well, thank you very much, Julie, and it's great to see both Arif and Adam. We don't get to see each other like many others in the workforce face-to-face anymore, and it's really lovely to see them both, and of course to be here with Julie and all of you that joined me at the round table here at the South Riverdale Community Health Center. Yeah, we'd had a great conversation, and when I walked in and I met so many of you, and I'm not going to go through everyone's names, but I'm looking at Capri here, and, you know, talking to people that work in community with people that are struggling with mental health and substance use issues, I said, these are, you are my people, because in fact, back in the day before politics, in fact, I worked on the front lines, and I say this because I want to also thank you for the work that you're doing. These folks that work here in these community centers, in the street outreach programs, with folks that are vulnerable, with folks that are often, as many of my mentors have said, not just sometimes homeless, but placeless. That takes a toll on you as an individual. There are documented. It's documented evidence that serving the most vulnerable is also a profound gesture of love that takes a lot from a person. So I want to thank all of you, because I know that you go home and you worry about the people that you serve, and you grieve with that community when there's a loss. And I know that the work that you do is profoundly generous, and I want to thank you very much. So before I go any further, I do also want to acknowledge the traditional territory of the Ojibwe, the Anishinaabe, and the Mississaugas of Credit. And it is such a joy to be here with you on their traditional territory. South Riverdale Community Health Center not only has been serving this community for 40 years, but has this vision statement: empowered, healthy, thriving communities where everyone belongs. That, to me, is a really good vision statement. I've done my own share of vision statement creations, and when I think about that, I think this is really the essence of the announcement today, that people have a right to be in their communities, to live to the healthiest life possible, to receive treatment for health conditions that they live with. And South Riverdale Center clearly gets that when people have an opportunity to fully participate, that we have a healthier community for everyone. And it's just wonderful to be here with them today. COVID-19, which is really all I get to talk about these days, has been obviously an unprecedented health emergency for our country and for the world. We've seen the world come together in ways that we haven't in a very long time, and we've seen the world fracture in ways that we haven't in a very long time. And yet, we've had a parallel crisis for many, many years. For well over 20 years, we've had an opiate overdose crisis in this country, and we've had people working to try and stem the loss of life as a result of opiate use. But COVID-19 has actually accelerated opiate overdose and deaths, and as the evidence starts to come out from cities and communities all across the country about the twin pandemic of mental health and substance use disorders and concerns, numbers are rising of opiate overdose deaths at the rate that we've never seen before, including right here in Toronto. For example, in July, Toronto reported a record high of suspected overdose deaths. And that's why today I'm here to highlight the work that these community organizations are doing to try and save lives and to try and tell every single person that's living with problematic substance use that they matter and that their lives matter. So today I'm confirming almost $9.5 million in total to help prevent opioid-related overdoses in Ontario. And $1 million of that fund will go to South Riverdale Community Health Centre to support people that are at risk of overdose. This 10-month project will provide pharmaceutical-grade medication to people experiencing opioid use disorder as an alternative to the toxic drug supply. It will also connect patients to vital health and social services. And this includes addiction and mental health services, which have been more difficult to access during the COVID-19 outbreak. Additionally, we'll provide more than $582,000 to the Parkdale Queen West Community Health Centre for similar work with the same population, which was announced by my colleague recently, Arif Irani, who is the member for that region, that area. But of course, the opiate overdose crisis is not limited to Toronto. This is happening across Canada and across Ontario. There are other cities and communities that are experiencing the devastation that problematic substance use leaves in its wake. So the Pathways to Recovery project in Ottawa will benefit from approximately $1.4 million over 10 months to expand its existing community-based services, which prescribe pharmaceutical opioids for people at the greatest risk of overdose and death. It's also important to think about how we can support people with opiate use disorders beyond the COVID-19 outbreak, as my colleagues told me today. So to help address this issue in Southern Ontario, the London Intercommunity Health Centre will receive more than $6.5 million for a long-term pilot project. And this project will provide prescribed opiates to eligible patients over a 50-month period. In this setting, they will also have access to a range of health and social services such as housing, food, security, and social connection. And the results of this project will contribute valuable evidence to support the development of best practices for safer supply programs that hopefully can expand across Canada. We've also authorized 3 sites to operate on an urgent public health need basis so people can stay safe from overdoses and limit their contact with others by following physical distancing and isolation measures associated with COVID-19. The first is being managed by the Parkdale Queen West Community Health Centre and is operated out of the COVID-19 Isolation Centre in Etobicoke. Another site is managed by Ottawa Inner City Health at the Roudier COVID-19 Isolation Shelter, and the third site is managed by Street Health Centre in Kingston. All of these locations offer supervised injection, oral, and intranasal consumption and permits and allow for peer assistance. They also provide harm reduction supplies and education. I think we have to have a fundamental shift in how we talk about substance use in this country. I think we have to talk about substance use in a way that acknowledges that these are our friends, these are our loved ones, these are our neighbors, our brothers, our sisters, our aunts and uncles, our parents. And we have to have compassion in drug policy. If we don't have compassion for the most vulnerable, then we will not get through any crisis together. COVID has taught us that. It's a lesson that we should have learned a long time ago. Projects like this are built on a foundation of compassion, a foundation of understanding that everybody is struggling. Some of us struggle more than others. Some of us have tools that are available to us that are not available to others. And I'm really proud to be part of a government that understands that we can't get through anything without compassion at the core. Thank you very much.
Excuse me. Hi, I'm Jason Altenberg. I'm the CEO here at South Riverdale Community Health Center. Welcome. I want to thank Minister Hajdu and our members of Parliament who are here with us today for this announcement and for this contribution to harm reduction work across Ontario. I also want to particularly acknowledge our partners who are here with us today. South Riverdale holds the funds for this announced program as part of a Downtown East collaborative that is an equal partnership between South Riverdale Community Health Center. Capri Rabin is here from Street Health, one of those partners, and Paulos Gabresis, the executive director at Regent Park Community Health Center, stands behind me. As well, Minister Hajdu mentioned our important citywide partnership on safer opioid supply with Parkdale Queen West Community Health Center, and Angela Robertson, the executive director, is here with us today as well. I also want to say that in East Toronto, I'm very proud of the fact that we are a member of one of the first Ontario health teams, and that we took the bold position that one of our first-year population health focus would be substance use in health. And I would encourage others across the province to take that up. Our East End Collaborative program announced today has already had over 120 referrals for safer opioid supply. In this 10 months, we will serve over 250 people, over 350 across the city. And I want to not only acknowledge our partners, but the communities of people who use drugs, who are our staff, who are our colleagues, our friends, our family, our community, and who've been partners with us in our collective efforts to protect life, health, and to provide access to justice, harm reduction, and healthcare services. The community-based organizations we stand here with today and the communities we stand with have this in common. We deeply partner with communities, and we respond to the needs that they bring to us. Below us and behind us stands a memorial to lives lost to the war on people who use drugs. A failed war, and a war on drugs that has led to drug policies, legislative frameworks, and programs that have failed to protect life and promote health. Now we have a poison drug supply that has created an unprecedented public health emergency made worse by the COVID-19 pandemic. This is a public health emergency that is not just local, it is global, it is provincial, it is national, and our communities are living in fear and grieving for thousands of lives lost. For decades, harm reduction programs and activists like our program founder here, Rafi Balian, decried the war on drugs and referred to it as a war on people. Those activists implored us to build our programs to create as much as possible conditions that were closest to those of a decriminalized state, that supported people exactly where they were at with respect for their histories, their communities, and their potential. These harm reduction interventions are lifelines and essential pathways to comprehensive social and clinical care for many. We need all levels of government, all public health and clinical leaders to join in this progress. We need these programs to be available to all people and communities who need them. Programs like Safer Supply that are appropriate responses to the emergency that we are in. We need these paired with policy and legislative reforms that will address systemic inequality, stigma, discrimination, racism, and colonization. We are relieved and grateful that policymakers and public health leaders are taking action to address this crisis as a crisis. The support we are receiving from Health Canada is so deeply welcomed, and I know we look forward to the support and collaboration from all levels of government to help us sustain and expand this important work. Thank you. I'll turn it back to Patty Hajdu. Back to you, Minister, for questions.
Thank you. The Minister will now take questions. We'll start with questions from the room. One question, one follow-up.
Good morning, Minister.
Morning.
So the provincial government has taken a stance against funding projects like this for safe supply. And now this is the second recent funding announcement from the federal government for these kinds of projects in Toronto and broadly in Ontario and the rest of the country. So I'm wondering if your government reached out to the province seeking to partner on this initiative.
Thank you for the question. Earlier in the year, I wrote to all provinces and territories urging them to do whatever is within their power to reduce the risk of opiate use and reduce the risk of opiate overdose deaths. In fact, BC recently took us up on that offer, and as you know, recently announced that nurses will be able to prescribe, and that's going to make a huge difference in terms of outcomes for people in the province of British Columbia. I think I would say to all leaders, there is evidence that we can draw from, and people need to follow the evidence. I know this is a very difficult conversation to have. There's a lot of work to do in having conversations with community, but people don't choose to be addicted to opiates. People don't choose to live a life full of trauma. And we have an obligation as governments to protect the most vulnerable in our community, including people who use substances. And there are, by the way, benefits to the entire community when people get the appropriate treatment for the condition that they live with.
And so do you think the provincial government should step up and start funding these projects, or at least partnering to fund these projects?
I think the provincial government should listen. I can't speak to their funding priorities, but what I can speak to is the tools that they have at their disposal. And I think what we need to move away from as governments is ideology and move towards science and evidence and work together really diligently to unlock the tools that community organizations need. And that is exactly the philosophy of our government. We know that the best work happens at community level. In fact, South Riverdale is well poised to serve the people, for example, in this community because they know the people in this community, they know the needs of this community. So I think all politicians and all political leaders need to understand and work diligently to save lives. This is about saving the lives of the people that we love. These people that die every single day are people's brothers and sisters, mothers and fathers, nieces and nephews. These are our family that are dying. And so we have an obligation to unlock every possible tool to support them just as diligently as we do for COVID-19.
Thank you, Minister.
Thank you. We'll take questions from the phone now. Over to you.
Thank you. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, veuillez appuyer sur étoile 1 maintenant. Notre première question est de Marc-André Cossette de Global News. Please go ahead. À vous la parole.
Yes, good morning, Mr. Thanks for taking our questions. First off, what is the status of negotiations with provinces that are not using the COVID Alert app to get it up and running in those provinces?
I think we're progressing quite nicely. I understand there's 2 Western provinces that are signing on today. I'm going to guess, I was briefed, I think it's Saskatchewan and Alberta that are coming online. And so the negotiations are, I think, accelerating. We know that our cases are rising in Canada, and the COVID Alert is an additional tool for communities to be able to provide citizens the ability to get fast and rapid alerts if they've come into contact with someone who has COVID-19. I urge every Canadian to download it who is in a jurisdiction where it's available. And if you're in a province and territory where it's not, please press your provincial leaders to make it available as soon as possible.
Thank you. We have no further questions registered at this time. Back to you.
Well, we have one more question from the room.
Hi, Minister. One more question for a colleague of mine in Ottawa. So Canadian projects to develop vaccines against COVID-19 are behind some of the leading candidates in the world, and some members of Parliament, medical experts, and private groups have pushed for the use of challenge trials to develop a COVID-19 vaccine. And there are 2 facilities in Canada capable of hosting these kinds of trials, but Health Canada says it hasn't received any applications thus far. So is the government considering encouraging these kinds of trials? And if it isn't, why do you think that even though the regulatory infrastructure exists for these trials to be approved, that companies are not applying to run them?
Well, I think, first of all, people need to know what a challenge trial is. A challenge trial is when you inject a live virus into a human host to do further research on either vaccine effectiveness or therapeutic effectiveness. And the challenge with challenge trials, no pun intended, is that they obviously are very risky for the person who's receiving that injection of the live virus, or that who is infected with the live virus. The issue is that we don't have an off-ramp. So if someone gets very, very sick, obviously, as a result of being a volunteer for receiving COVID-19, there isn't a way to actually treat them effectively in some cases. And so at this point in time, no country in the world is using challenge trials. There would be a number of ethical hurdles to go through in order to determine if that was an approach. And at this point in time, Canada is not considering challenge trials.
Thank you, Minister.
Thank you very much. There are no further questions.